I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, it comes down to caring and sharing again. We care about ourselves such that we take good care of our medical problems and go and see our doctor, take our medicine. That's what we do. And in doing that, you set an example for everyone around you, your children, your spouse. Everyone would want to take better care of themselves. That's what it's all about. Caring and sharing. And don't forget, don't let those med moments go by. You know what a med moment is when you're walking upstairs and that knee pain. That knee pain is telling you something. It's telling you that something is wrong. And at that point, you should take care of it. Don't let it linger. Don't ignore the med moments. Alrighty. And listen, I'm so appreciative of everybody who's, coming in and looking at us on OBHealthy.com. We have so much educational material there. Just come check it out. It's so informative. All the medical educational material is on that website. And Facebook, Obey Your Doctor, as well as Instagram and Twitter. We're on all the social media as well. So check us out. Alrighty. I'm doing a series now for my Let's Talk, a segment. And the series is going to be about weight loss. And the reason it's going to be about weight loss is because weight has a direct correlation with disease entities. So let's just talk about this for a minute. What is overweight? Overweight is usually if there's an increase in muscle, bone, fat, or water content in the body. That's when you're overweight, if you have too much or excess of that. Obesity, now understand, obesity they usually say is an excess of body fat, and body fat is the majority portion that's overdone. So you have a lot of fat in the fat cells, and that's the part that makes you obese. Let's look at some facts here. Some facts to tell us what the population actually, the visions of population as far as obesity, as far as weight loss is concerned. More than 2 in 3 adults are considered overweight in the United States. More than 1 in 3, or 1/3 of the population is obese. More than 1 in 20 are extremely obese or morbidly obese. And as far as children and adolescents are concerned, 1/3 of children between the ages of 6 to 19 are considered overweight. 1 in 6 child or adolescent between the age of 6 and 19 are considered obese. These are tremendous numbers. So we really must take hold and really recognize that we have to really start decreasing weight, because this is a way that we can stay healthier, okay? Because remember what I said, health has a direct correlation as far as obesity and being overweight is concerned. All right. So what we want to do is get closer to our ideal body weight, and that's the amount of weight you should carry for your height. So for more information, go to eatonehalf.com. There's more information about weight on that website. Remember, eatonehalf.com. All right. Let's get to the main part of our show tonight. What we're going to talk about is common surgical diseases. All right. And I have the perfect person to talk about these particular diseases. I have Dr. Kevin Clark, and he is a surgical oncologist at Newark Beth Israel Medical Center. Dr. Clark, welcome to our show.
Thanks for having me.
All righty. So you're here again. I'm telling you, I'm going to have to start charging you rent coming here all this time. But, these diseases are common diseases that we're going to talk about. Mm-hmm. And I had called Dr. Clark and I asked him exactly which ones should we talk about. And he gave me 3. And first, we're going to talk about hernias. Second, we're going to talk about gallbladders and appendicitis, right? Yep. And I'm hopefully we can get through all 3 of them. If we can't, then we'll have you back and we'll continue the series from there. All righty? Now, hernia. I've got to ask, what is a hernia?
So a hernia really, typically when we refer to hernia, we're talking about an abdominal hernia.
Now, abdominal, you mean in the tummy region?
In the belly, right,
All right.
in the belly area. It's really a weakness in the abdominal wall. So the abdominal wall basically represents the covering that prevents the intestines from the outside.
Okay, so let's step back for a second. The wall here in our abdomen or our belly region, go through the layers for me. It's skin, and what happens
So
there?
there's skin, there's fat, there's muscle, and
Okay.
then there's a layer called a fascia.
Fascia. That's the inside layer.
That's the inside layer.
Right, right.
And that constitutes the abdominal wall. So
Okay.
anytime there's a hole or what we call a defect, the contents inside can come out, and that's essentially what a hernia is.
Okay, hold on now. You know, I'm walking down the street, and all of a sudden, bloop, it's going to just plop out.
So normally, there are a couple areas. If you have where the belly button is, that's an area that's weak.
That's a weak area.
That's a weak area.
all
So
right.
that's intrinsically weak. Also the groin. So both groin areas are also potential areas of weaknesses where you can have a hernia.
Okay.
Now the other areas that you can get after surgery, if you have an incision,
Okay. So where they cut you, and when it heals, it doesn't quite heal as strong as it was
Right.
prior to being cut.
Right.
Okay.
and that can also be a site for a hernia.
Okay.
Probably the most common area that we're gonna see it's in the groin, in the
Okay.
in the groin region.
Okay.
And that's because that area itself, similar to the belly button, it's a natural area of weakness in the abdominal wall. So especially if people do heavy lifting and put pressure, that's one of the more common areas where you're going to get.
Okay, so let's step back just for a second here so I can make sure I understand this. Now, a hernia is when it's actually the muscle just kind of splits. Is it the muscle that splits and let the bowel come squeezing through the muscle? Is that what happens?
It's all of the layers.
All of the layers.
So the fascia separates, the muscle separates, the fat separates, up to the skin. Now,
Up to the
the skin is still covered. Otherwise, it'll be
Right.
completely exposed.
Right. So everything kind of separates, and and the key thing about this is that hernias come about because we maybe pick something up heavy, and when you pick something up heavy, what happens? We put a lot of pressure on our abdomen, right? Or the stomach region. It pushes down,
Right.
and it pushes the abdominal contents, which is our bowel, excuse me, our bowel pushes against the wall of the stomach, or the
Abdominal wall.
and then it pushes through the muscle, and as it pushes, it eventually a wide hole develops where the content can come out to the skin.
Right.
Am I right about that?
Yeah.
Okay, all right. Because I was a little confused as to how that actually happened with this hernia thing. All righty. So, when does it happen? Is it more like in early part of life or later part of life? When does hernias usually come about?
So you can get an umbilical hernia.
And that's the navel. That's the navel.
Inside the navel.
Yeah.
And children usually get that. Now, it's an area, congenitally in development, it's an area of weakness. But it normally fuses, and after age 2, if the hernia it usually goes away by age 2.
Right.
So if it persists, then it has to be fixed. Now, because it's a natural area of weakness, you can get a hernia there at any point in life.
All right.
And especially if you put a lot of weight on, as you were talking about before, that can put a lot of pressure on it. But at any point in time, that area, because it's naturally weak, you can get a hernia there.
Okay.
Now, the more common areas that you're going to get hernia is the groins, as we spoke about before.
Right.
Now, the types of hernias that you get, it could be what we call a direct hernia or an indirect groin hernia. Now,
Okay. Go ahead, explain that.
part of the reason why you get a hernia in that area, it's not just because it's a natural area that's weak, but in development, the way how the testes gets its location in the scrotum, it travels from the back of the abdominal wall all the way into the scrotum.
So it travels around.
Around
until it gets where it needs to be.
Right, and it goes through the inguinal canal and then stays in the scrotum. Now, in that process, there is a structure that allows it to travel all the way down. Now, that structure can remain patent.
Right.
And because that structure now is from the abdomen to the scrotum, if it's patent, it can naturally allow things to go back and forth.
Through. Okay.
And that's
go
that's
ahead,
more that's an indirect hernia.
Okay. All right.
A direct hernia is it's when the actual abdominal wall itself is weak,
Right.
and allows things to come through.
Okay. All right then. There were several words that you said in there, like patent, meaning that it's an opening.
It's an opening,
and
right.
that this area and the bowel can push through that because that opening is weak. Because when the testes formed, they came around and they left a track.
Right.
And that open track, if we bear down the bowel can actually push through that opening and come down and form the hernia down there.
Right.
And you'll find that more in men than women, right?
Right. Right. It's much more common in men, and
Okay.
you'll see a bulge not only in the groin, but it'll go all the way into the scrotum. So it's not
Oh.
uncommon for you to present with an enlarged scrotum that represents intestinal contents going all the way into the scrotum.
Wow. Now, what about as far as does the bowel ever get in trouble when it goes through these, pushing through these like channels and through the muscle and stuff? Does it ever get in trouble by doing that?
So a lot of times it does. And part of the problem with a hernia, apart from being a nuisance and having pain associated with it, the real problem is what we call incarceration or strangulation. Now, these are big words, I'm going to explain them.
All right.
Because the bowel goes through that tract,
Right.
it can become stuck.
Oh, all
If
right.
it gets stuck, let's call it incarcerated.
Okay.
When it gets stuck. Now, the problem with being stuck is the blood supply now gets compromised.
So it gets cut off.
It gets cut off.
Oh, man.
And once the blood supply gets cut off, the intestines can die. And that now becomes a surgical emergency. Patients can get very sick from that.
Right.
So we tend to fix or recommend to fix the hernias in all cases whenever they happen because of the risk of this incarceration, it getting stuck. And if it stays stuck long enough, it'll become strangulated,
Right.
where the blood supply now becomes cut off. And patients can get very sick from that. So.
Oh, goodness gracious! Alrighty, is it a family thing? I mean, if my father had a hernia, am I more likely to have a hernia as well? Most of the time.
I'm not so sure it's really familial. I think a lot of things predispose to it. Again, it's a natural area of weakness. It tends to do more with your activity. So again, if you do a lot of manual activity and heavy lifting, you're putting a lot of pressure. If you're coughing a lot, patients with COPD have a lot of pressure that they put on.
Right.
If you're obese, again, you're putting a lot of pressure on the abdominal wall. So it really has to do more with the activity, more so than familial, really.
Okay. Now, how do you correct a hernia? What do you do to correct it?
So there are basically two components.
Okay.
Again, you have to reduce the hernia. So
Reduce.
So reduce meaning returning the contents, the intestinal. For instance, if the bowel now goes from the abdomen into the scrotum,
Right.
you now have to return
That back to the
abdomen.
abdomen. So you have to push it back up.
You have to push it back in. So you have to
All right.
reduce the hernia itself.
Okay. All right.
And then you repair it. So that defect has to be fixed. Now, depending on the location and the size, you can repair it primarily, which means you put sutures in and you pull it together to close the defect.
Right.
Or you could put something in called a mesh. And that
Right.
mesh, it's a prosthetic material that we use, and there are multiple different types. And it serves as a bridge to cover the hole itself.
Okay.
And then you suture around it and cover the hole, as opposed to bringing it primarily. Now, the reason to do one versus the other, you can imagine the tissue, if you have a hernia there,